this afternoon, and the New York City Board of Corrections, January 10th, 2024 meeting is now in session. I'd like to start by introducing our newest board member, Mr. Jude Toshinot, and I apologize if I butcher it a little bit, but I will get it. Mr. Toshinot is a graduate of Columbia University with a master's degree, and it has a remarkable 33-year tenure with the Administration for Children's Services. When I first met the new board member, I said, you know, he must have started when he was like 4, because he has that very youthful look, which is, you know, congratulations to him for that. As a community advocate, supervisor in child protective services, and various other capacities. He has been a steadfast advocate for the well-being of children. Beyond his professional role, Jude has devoted many years of service to community advocacy, skillfully bridging the gap between the agency and the broader community, and ensuring the families within the child protective realm receive the best possible outcomes. His commitment to fostering understanding has been instrumental in enhancing public awareness of the agency's vital functions. Welcome, Jude. If you'd like to make some comments, please.
Ladies and gentlemen, esteemed colleagues and members of the public, firstly, I would like to express my gratitude to the chair and fellow board members for entrusting me with the responsibility to serve on the New York City Board of Corrections. It is both an honor and a profound responsibility. I am committed to advocating for policies and practices that promote transparency, accountability, and fairness. The public has placed their trust in us to oversee the operations of our jail system, and we must uphold that trust through our actions, decisions, and communications. So in closing, I'm eager to collaborate with each of you, drawing upon our collective expertise, insights, and passion for reform. And together we can make meaningful progress towards a more just, humane, and effective correctional system for all. So thank you, and I look forward to our shared journey ahead.
Thank you. Our first order of business is to vote on the agenda for today's board meeting. Which board members have received? Will a board member move for a vote to approve the January 10th, 24 meeting agenda? Board Member Bedard.
Can I make an addition to the agenda, please, Chair? I'd like to just add an item around the opening of the Elmhurst Women's Psychiatric Unit.
Are there any objections?
Good idea.
It will be added. No problem.
Thank you. Then I move to approve the agenda.
Is there a second? Does any member have edits or comments on the agenda? There being none, all in favor of approving the January 10th, 2024 agenda? Any opposed? Okay, the agenda is approved. Our second order of business is to vote on the draft minutes for the November 14th, 2023 board meeting. Which board members have received? Will a board member move for a vote to approve the November 14th, 2023 board meeting minutes?
So moved.
Is there a second? Second. Does any member have edits or comments on the minutes? There being none, all in favor of approving the November 14th, 2023 board meeting minutes? Hearing that no objections, they are approved and duly ratified. At this time, I'll have our Executive Director for the Board of Correction to make announcements and updates. Ms. Jasmine.
Thank you, Chair. Good afternoon, everyone, and Happy New Year. I'll just start by giving a brief update on board staff's work. In 2024, we're excited to reaffirm our commitment to independent oversight of the city's jails, transparency, accountability, and data-driven policymaking through rulemaking, investigations, and timely evidence-based reporting. The board's minimum standards remain the leading standards nationwide for conditions of confinement and access to health and mental health care for people in custody. Over the past year, due to the persistence and extraordinary contributions of the board staff, the board has successfully monitored and ensured compliance with several minimum standards, auditing processes to recommend improvements. Each day, we're reminded of the structural and long-standing challenges facing the city's jails and the personal hardships generated and compounded there for people in custody, people who work there, and everyone who cares about them. BOC staff are committed this year to our own transparency and accountability by regularly reporting at each meeting our findings, concerns, and questions regarding a particular topic that is covered by the board's minimum standards. This will help make transparent the great volume of work undertaken by BOC staff. Last year, despite difficult circumstances, we published 2 death reports and a report on the NYC fire. And in 2024, we're committed to providing more frequent and timely reporting centered on deaths, serious incidents, and minimum standard compliance. As we support the board in carrying out its independent oversight, we look forward to ongoing conversations with DOC, CHS, advocates, and different stakeholders to achieve compliance with the board's minimum standards and ensure structures of accountability and transparency are in place. Collaboration between all of these stakeholders will ensure that the board is well positioned to think critically and compassionately about the difficult issues at hand. Next, I do want to share our deepest condolences with the families of department staff who have died since the board's November meeting. The staff who have passed are Officer Mark Williams, retired Captain Shell Harrison, retired Officer Kevin Jones, retired Officer Cynthia D. Walker, retired Captain Rory McAnell, retired Grievance Coordinator Pauline Mims, retired Officer Vincent J. Gill, retired Captain Robin Davis King, retired Officer Craig J. Williams, retired Officer Darlene Rhodes, retired Officer Frank Acalina, and retired Captain Raymond Anthony Casey. The board was also saddened to learn of the latest death in custody. Mr. Chima Williams, age 43, died in EMTC on January 5th, 2024. Mr. Williams was in the gym playing basketball at the time of his passing. His cause of death is currently unknown. We express condolences to Mr. Williams' family and loved ones. The board is actively investigating this death and will issue a public report on its findings. Next, an update on census data. As of January 9th, 2024, there were approximately 6,056 individuals in department custody. And that's a 5.8% increase in the population from January 1st, 2023, when there were approximately 5,726 people in custody. And next, I have an update regarding reporting. On December 22nd, 2023, the Board of Correction released a report on our findings and recommendations concerning the fire that occurred in the North Infirmary Command on April 6, 2023. Some of the concerns highlighted in the report include DOC shutting off the sprinkler system water supply to the housing area where the fire took place sometime between April 2022 and April 2023. A lack of weekly and monthly fire safety reports and audits for that same time period, individuals not being allowed out of their cells for over 25 minutes once the fire ignited, issues with fire safety staff deployment, among other concerns. The board made 12 recommendations to the department with the aim of improving NIC and fire safety operations, and that report is available on the board's website for public viewing. And regarding the upcoming death report, prior to the board's next meeting in February, the board will issue a report covering the last 4 deaths that occurred in DOC custody in 2023. This upcoming report will feature our findings on the deaths of William Johnstone, Curtis Davis, Donnie Ubiera, and Manish Kunwar. The report will also include recommendations to the department and CHS on areas of improvement in operations and policies to avoid further tragedies. Our commitment is to accuracy in reporting, and our objective is to publish a final report regarding a death in custody within 6 months of the death as investigation circumstances allow. And in addition to the upcoming death report, in the coming months, we will issue an assessment of the use of chemical agents in NYC jails. We'll share our findings and recommendations with the department and provide them with an opportunity to respond. And that concludes BOC staff's updates.
Yes, go ahead, Board Member Carr.
I want to commend Jasmine and her staff for the report on the fire. I thought that was excellent. But I would like to add one thing. As I understand it, the fire took place in NIC, in the worst unit on Rikers Island, pretty much. It's the unit that Commissioner Molina said should be shut down immediately. It was a restrictive housing unit, and I think it's important to understand the response could be related to those kinds of units, which are very difficult to maintain. They don't have a lot of space. People are locked in all the time, lots of the time, and I just wanted to stress that.
Thank you, Dr. Carr. Any other board members have any comments to the executive director? Okay, thank you. I'll just make some brief remarks. Not any prepared remarks. I don't usually have prepared remarks. But I can say that, one, it is a new year, and hopefully it's a happy and healthy new year for everyone. And in this new year, it is my commitment to really develop the board and the board members' continuity as we move to work together and move forward to meet our mandate, our charter mandate, which is critically important to providing the humane and safe and well-being of all involved in New York City jails. I also want to say that I'd like to welcome a new commissioner, Commissioner Magdalene Liddy. Congratulations on your appointment. And in this new year, I ask that you be a little patient with us, because in really coming together, there's some real tough decisions and some tough debates and tough discussions that go on among the board members and the advocates and others, but there is a strong commitment to really move the needle forward on my behalf in this year, 2024. So, thank you. That concludes our staff updates and chair's comments. Now we'll go to PIC public comments. We will now hear public comment from people in custody. Thank you to all who left public comments on our dedicated lines for people in custody.
Hello, my name is Paul Alexander. I'm in NIC. My number is 200-210-2165. Again, my name is Paul Alexander. My number is 241-200-2165. I really needed some help from your office, please. My computer tablet, they gave out little computer tablets to make phone calls and call commissary and order commissary on, but my touchscreen isn't working right, and I need it replaced. If you can please try and help me have the tablet replaced. You know, making phone calls is really important, and being able to order commissary is also important. And for some reason, the touchscreen isn't working right. Please, can you help me with this? When I try and get them some help with it, they just pretty much ignore me. But if you were to make one or two calls, it's a lot stronger coming from you guys than me trying to have it replaced. I just need the touch screen isn't working right, so I just need to replace it with any one that does work. You know, I don't even want a new one. If it can just be a used one that where I can make calls. You know, because it's important to be able to speak to my family. And I had called about other issues, and I was wondering if anything or any progress has ever been made on those. But I appreciate your help with this. Thanks so much. Please don't ignore the call.
The caller has hung up.
I am in OBCC, Dome 3 Upper. I've been going through a situation with an officer named Asensio, Asencio. I had 3 or 4 weeks ago pressed sexual harassment charges on her 911 report and 311 reports. Ever since then, she's been sending officers at me. She got a security officer named Lewis to back me up. They had me in the intake for 12 hours. They stole my commissary. They moved me back to the dorm. A couple of days later, at a shakedown, she sent Officer Hyde security at me, and he took all my medication, all my property, all my clothes. Then she had wrote me a ticket. They gave me disobeying a direct order. My classification was -2. How do you go from -2 to 14 for disobeying a direct order? And they just gave me loss of commissary for 1 week because she said that I disobeyed a direct order and didn't want to put on a pair of pants that were large when I'm size 3X. She tried to make me put a pair of large pants on after she stole my pants out the shower when I was taking a shower. That was a sexual harassment charge. But anyway, this is what's going on, and right now she's threatening me with sending me to the tower to get beat up by her friends, the Trinitarios. Thank you. Can you please contact me as soon as possible? Thank you.
The caller has hung up.
Yes, this is James Lumpkin calling. I'm currently housed at OBCC Correctional Facility, 1600 Hazen Street, East Elmhurst, under DIN number 141-2300-846. Living conditions is horrible still in OBCC. There's no basketball rims that's worth working out on. They only have 2 bars, workout pull-up bars for inmates. Roughly maybe 100 people was in the yard at a time. So it's really, everything is overcrowded. We on top of each other. There's no water running. There's no water fountain out there, which we should be entitled to have water after working out or playing basketball. Or upper housing area, when it rains in here, when it rains outside, the rain comes through and floods the whole housing area, well as the day room. Nothing has been done. They got a small barber shop. We're not getting haircuts in a timely fashion before trial. We going to court without even, being able to groom myself properly. Some mornings they don't even have toothbrushes. So what is the night shifters doing if they can't restock the stuff that was used throughout the day? What is the night shift here to do? There's no movement. It should be getting refurnished. Everything should be getting refurnished up. All the supplies that's needed. None of that's happening. They run out of blankets. We have to get another man blanket. Exposes you to bed bugs and anything else that this person might have on his skin. What happened to take his blanket? Some days we don't even get laundry. Weeks we don't get laundry. You have to wash your own clothes out. This is inhumane. They got us housed in here. Most of the guys don't got winter gear. proper winter gear, and if they do give it out, it's 2 sizes over the original guy's size. So what is really going on here, you know? Officers is just, you know, basically sleeping on the job, you know, penalizing us when we do things, but they clearly, then they harass our family. This is the biggest one. They make our family wear masks. Like these officers is walking around the jail actually wearing masks. They don't wear masks all day. So why you know, my family come to see me, they want to see my face. They want to make sure I'm okay. My son come see me, want to see my face, right? Why are they making me wear a mask, right? When actually I don't wear masks all day when I'm in jail around them, and they go home to their family and come back and bring germs in here, cough in front of us, and do things to us.
Dr. Cohen, you have questions regarding the public comment?
Yes. I just, for Jasmine, our executive director.
Turn your mic on.
The question is for Jasmine. Could you let us know what the board staff response to these direct complaints have been and its planned?
Well, the board staff are assigned to different facilities, so we will continue to look into the issues that were raised today, and we can follow up at the next board meeting or prior to the next board meeting, of course, with DOC and with board members.
Okay, thank you. Any other board members have questions on the public comments from PICs? I think at one board meeting, we explored the idea to have persons in custody testify in person, if at all possible. Has there been any discussion or thought on that from staff or the department?
We haven't had the opportunity to speak with the new commissioner about that, but I'm happy to reach out to her to do so.
Okay, thank you.
On that note, even before or subsequently, could there be a way for people in custody to be able to see the hearings? Could they attend and see our public hearings?
I think that can be a part of the discussion from the executive director to
Thank
the
you.
department as well. Okay, at this time, we'll now turn to DOC for updates on items listed on the agenda. We'll start with opening remarks from the commissioner, Linnell Liddy. Then Jasmine will provide background on the substantive issues, followed by responses from DOC executive staff. But even before you begin, Commissioner, I'd like to thank your Deputy Commissioner, Dr. Gonzalez, for working with Board Member Pitts and establishing, I think it's the first ever where people in custody were actually with the newer class in the academy to provide some insight as to what they may encounter on the job before they get on the job. So, Ms. Pitts, if you'd like to make some comments on that session, or Mr. Ramos, who was also in attendance.
Okay, good afternoon. I too thank Deputy Commissioner Dr. Gonzalez for allowing formerly incarcerated to speak to the recruits at the academy yesterday. They were given some scenarios by him. He told them things that they needed to be aware of, that they needed to look out for. And by the evaluation instruments that I collected from them, they received the seminar very well. There was nothing that they thought was irrelevant, and they were grateful for the additional information. So I thank you, sir, for allowing that to happen. As far as I know, that was the first time that formerly incarcerated has gone to an academy, a law enforcement academy, and spoken to correction officers. And hopefully we can develop it more and maybe continue. Thank you.
Mr. Ramos, any thoughts, comments?
I just want to ditto everything that
Turn your mic on, please, so we can have you recorded.
I just want to ditto everything that Ms. Pitts elaborated on the commissioner at the academy, and I'd like to thank the deputy commissioner for training at the academy. Going to the academy yesterday took me back 20-odd years, and looking at these young people sitting there in their uniform, looking as sharp as all hell, and very well versed, by the way. You could tell that the training was excellent. The questions that they asked were relevant, and not only that, but they were also concerned with what the Board of Correction does, and also how they are looked at from the outside. And one of them in particularly got very sensitive about the people in politics making decisions for what they do in the Department of Correction. I think that that's important because of the fact is that demoralizes the work that they do in the four walls of correction. But they were also very sensitive to those that were behind the other side of the Department of Correction, and they're very cognizant of the people that they need to work with and to try to see if they could be conducive in the growing process so that they don't come back in practicing recidivism within the Department of Correction. But it was an excellent seminar. The people that had experience living in that type of facility for 25 plus years, they were able to share their experiences with the new recruits, and it was well reserved. Anyway, we would like to thank the Academy and Dr. Gonzalez for allowing us, and the Commissioner for allowing us to go and visit at the Academy and to provide this kind of information. I think that we should look at it, and I think we should, place a lot more confidence in this particular training and see if we can continue that type of program within the Academy.
Thank you. So you know that there was staff attendant, BOC staff in attendance, and at our next board meeting in the board book, there will be a tour report for that session. Commissioner, I apologize for keeping you standing.
That's okay. Thank you for that. Thank you for your feedback. We look forward to continuing our collaboration with you. Good afternoon, members of the board. Happy New Year. My name is Linnell McGinley-Liddy. Before we begin, I want to thank the board for acknowledging the members and retired members of service who we've lost since the last meeting, including the untimely death of Correction Officer Mark Williams, a well-respected young officer who lost his life at 33 years old and served the department for the last 5 years. I also want to express my deepest condolences on the passing of Mr. Chima Williams. I can assure you that both department and CHS staff responded immediately to Mr. Williams and attempted to save his life. His passing is tragic, and our whole department joins the board in extending our sympathy to the loved ones of all who have passed. Today I'm joining you as the department's newest commissioner. Although I'm joining you in this new role, my commitment to this department and the people in it remains the same. Some of you already know me and have worked with me, and I look forward to continuing our productive partnership and shared goals for integrity and reform. For those who I haven't met yet, I would like to take this opportunity to introduce myself in my new role as Commissioner and share my values and goals and those of my team joining me today. First, it is my honor and privilege to lead the men and women of the Department of Correction at this crucial time. Their dedication and commitment to the agency cannot be overstated. Being a correction officer is one of the most difficult jobs in law enforcement. The people who work at DOC are committed to criminal justice reform based on their personal experiences and aspirations. I am confident that their passion for their work will continue to be the vessel for enduring change as we continue to further the mission of maintaining the safety of people in our care. Second, I've always been deeply committed to public service and using the law to support communities. I joined the department in 2015 as an agency attorney in the legal division, and in 2018, I became Deputy General Counsel. Through these roles, I was responsible for providing guidance on litigation matters while advancing reforms. 3 years later, in 2021, I was named the department's first Deputy Commissioner. Third, I know the Department of Corrections, its strengths and weaknesses, and those who work there know me. As first Deputy Commissioner, I prioritized supporting staff and detainees during the COVID pandemic through testing, vaccination, and engagement. Beginning in 2022, I began overseeing the department's Health Management Division, HMD. And after reorganizing the division and implementing revised practices and procedures, and as this board is well aware, the percentage of staff members out sick decreased some 80% from January 2022 to present. The process taught me two things. Significant change can happen, and we can achieve it by working together collaboratively. Given my years of experience of DOC, I come to the role of Commissioner with a deep commitment to the men and women of DOC and the people we serve. I recognize a positive working relationship with the board is a key aspect of this work. I remain committed to ensuring that the BOC minimum standards are upheld and transparency is maintained. As this board is aware, the department's issues are complex. I look forward to a partnership with the Board of Correction focused on thoughtful, meaningful, and expeditious reforms. Achieving a safe, secure, and humane environment for those who work and live in DOC facilities is my ultimate priority as Commissioner. If I didn't think this city could make the necessary reforms, if I didn't think we could create a safe and humane environment for both staff and everyone in our care, I would not be here today. I look forward to working with the entire Board of Correction to our shared priorities and reforms. Thank you for the opportunity to speak today. My team and I are available to answer your questions as per the agenda. Thank you so much.
Thank you, Commissioner.
Thank you, Commissioner. And I'll just give a background on the agenda item, the first agenda item for DOC updates. So the board has asked the department to share its plan for addressing complaints regarding lack of access to bedding, which is BOC Minimum Standards Section 1-03 Subdivision I, linen exchange and laundry services, which is BOC Minimum Standards Sections 1-03 Subdivisions G and H. And just as background, the Section 1-03 Subdivision G requires that department-issued clothing be laundered and repaired at the department's expense. Upon establishment and operation of clothing services, the department shall provide all persons in custody upon admission at least 2 shirts, 1 pair of pants, 4 sets of undergarments, 4 pair of socks, 1 pair of suitable footwear, and 1 sweater or sweatshirt to be issued during cold weather. Section 1-03 Subdivision H requires that laundry service sufficient to provide people in custody with a clean change of personal or facility clothing at least twice per week shall be provided at the department's expense. And Section 1-03, Subdivision I requires that the following bedding items be issued to a person in custody upon admission to a facility: 2 sheets, 1 pillowcase, 1 mattress cover, and sufficient blankets to provide comfort and warmth. And all bedding items must be checked for damage and repaired or cleaned if necessary prior to being issued. Pillowcases and sheets must be cleaned at least once each week. Blankets must be cleaned at least once every 3 months. Mattresses must be cleaned at least once every 6 months. Mattresses must be constructed of fireproof materials. Mattress covers must be constructed of materials both water-resistant and easily sanitized, and all items of clothing and bedding stored within the facility must be maintained in a safe and sanitary manner. And so those are the minimum standards. Our staff, in reviewing grievances that the department received from November 1st to December 26th of 2023, found a total of 59 complaints regarding bedding, linen exchange, or laundry. And our staff have been monitoring the linen exchange in the different facilities and will continue to look into the issues and closely monitor it and work with DOC to remedy any ongoing issues. What we found was that OBCC had the most grievances during that period, 19, followed by West Facility, which had 14, and then GRVC had 12. And just a summary of the issues reported at OBCC, they primarily revolve around the lack of access to bedding, linen exchange, and laundry services. Multiple individuals highlighted concerns related to bedding and linen exchange. Numerous complaints mention the absence of mattresses, blankets, and sheets. Some individuals have reported not having a mattress for an extended period, which violates the Board of Correction minimum standards. Laundry services, people in custody express frustration over irregular and infrequent uniform and clothing exchanges. Some complain about wearing the same clothing for extended periods, leading to hygiene concerns. Access to basic necessities, several individuals are requesting basic items such as socks, underwear, and hygiene supplies, indicating a possible deficiency in these items. And in terms of temperature control, complaints about extreme cold temperatures in cells and a lack of blankets or adequate clothing to combat the cold have been raised, posing potential health risks. And there are also issues in West Facility revolving around linen and uniform exchange, as well as issues reported at GRVC revolve around linen and uniform exchange. So as I mentioned, the board staff are looking into the issues that have been submitted as grievances to DOC. We are communicating with DOC about those complaints and what's being done to remedy them. As I mentioned, we've asked the department to speak on those complaints, and so I'll just turn it over to whichever staff is going to respond.
Good afternoon, Chair, members of the board, Commissioner, colleagues, and the citizens of New York City. My name is Allison Pace, and I am the Associate Commissioner of Facility Operations. I'm here this afternoon to address your questions regarding linen exchange and laundry services. To give you an overview, the department is committed to ensuring all persons in custody have access to the necessary items to ensure a safe, humane, and sanitary environment while all in our care and our custody. Upon admission, a person in custody is provided the following linen and bedding: 1 washcloth, 2 sheets, 2 towel, 1 pillowcase, 1 fire retardant mattress, sufficient blankets to provide comfort and warmth. Additionally, the department provides each person entering custody with the following clothing items: 3 uniforms, 3 undergarments, 3 pairs of socks. Once persons in custody are housed, linen exchanges is to occur on a weekly basis, and uniform exchange is to occur 2 times per week. Please keep in mind that this process is an exchange. A person in custody must surrender their soiled uniforms and items in order to receive clean ones. Additionally, persons in custody have the opportunity to do their own personal laundering in the housing units 2 times per week. The division storehouse supplies mattresses, blankets, pillows, and uniforms to the facilities on a quarterly basis. Correctional Industry Division supplies all other linens, including towels, washcloths, sheets, to all facilities. The facility makes requests for additional uniforms as needed. Housing area officers are responsible for abating complaints and concerns as any deficiency in linen or clothing is brought to their attention. This process could be done in conjunction with the facility clothing box officer. It is the ultimate responsibility of the Assistant Commissioner and the acting warden of the facility to ensure the needs of people in custody are addressed and met at their facility. Finally, persons in custody have the opportunity to file grievance related to laundry or any other matters. Out of a population of approximately 6,000 individuals, 27 complaints related to laundry were filed in the month of December. That constitutes less than 1% of our population. 1 was related to personal laundering, 15 were related to uniform, linen exchange, 8 due to a lack of an item meaning identified size or any just information in terms of size for individuals or length for individuals. There are 3 related complaints. Many of these complaints are pending resolution. Every complaint is important to us, and we want to ensure that those in our care and our custody's concerns are addressed timely and appropriately. Chair, board members, public, I am here in partnership with you. We are here in partnership with you to be of service to those who are in our care. We need the support, we want the support, and we have a shared goal as a department to ensure that we have an environment that is safe, secure, and humane, and is sanitary in condition. I am here to answer any questions that the board may have.
Well, thank you very much. Any questions from the board? Dr. Bedard? Yes, 2 minutes.
Wait, I'm gonna do this so I can look this way. Can you hear me now?
I can hear you
Okay.
now.
Hi there.
Yes.
Thank you so much for that presentation and for giving us an overview of how the system is supposed to work.
Yes.
I visited West Facility, the new dorms that had recently been opened
Yes.
after VCBC was closed in early December. I heard from people who I spoke to, people in custody and officers on those units, that linen exchange was a major problem, that some people said that they had gone over 30 days without linen exchange. I want to just read one complaint that we have recorded that exemplifies this concern. This is a message from somebody who was in West Facility, who had called to say, for the last 3 months, sprung 12, there's not been a closed box exchange. Therefore, we have no linens, thermal, sock, coats, hats, and other clothing. I spoke with the captain and the DEP for the past 3 months without receiving any assistance. It's cold now, and we are not able to get recreation because we don't have the proper clothing to wear outside. This is my 3rd request, and still no help. Can you just talk us through what happens when you get a call like this, how it's responded to, whose responsibility it is to close out this kind of concern?
Yes, if it's in the form of a grievance, 301 complaint, our Director of Grievance Services will address these matters. However, it is our responsibility. It is our responsibility as individuals, whether it's from a correctional officer, correctional captain, correctional assistant deputy warden, warden, or associate commissioner, to address these concerns. When they're brought to their attention, they're required to tour, and when these questions or concerns are brought to them, it is their responsibility to answer, and answer in an expeditious manner.
And do you have a sense of where the breakdown may be happening when people are going for weeks without having these kinds of grievances resolved?
So I'm going to tell you, we are a system that we understand that we do have some deficiencies, but I can tell you that we are also a system committed to change, committed to identify any shortcomings that we have and address them. Follow through is absolutely everything. And a part of that is working with the staff, working with our leadership to ensure that we are also following up on things that is said. That, part of our job is investigative in nature. And when we investigate and we find that there are deficiencies and there are actual issues, a part of that is retraining. We talked about Dr. Gonzalez and the openness and the commissioner's openness to having individuals come to training. A part of what we are doing is retraining as we are rebuilding some things. And that in itself is important to us.
Thank you so much for both acknowledging that you have work to do and for affirming your commitment to do it. I think we all look forward to hearing how things are going in a little while after you've been able to make some of those changes.
Yes, ma'am.
I have a couple of board members I'll acknowledge in this order. Ms. Sherman, Dr. Cohen, and Felipe.
Thank you, and thank you very much for those remarks. I guess my question had to do with how, when officers, captains, et cetera, are responding to complaints of the nature that we've been discussing, how are they expected to document the complaints? What writing, what written record of the complaints is in place, and how are those reviewed throughout the department?
If it's in the form of a grievance, the grievance process will be followed with the documentation. If there's a request for an item, then that item, once it's delivered, our logbooks are everything. We ensure that these things, when there's an exchange of laundry or exchange of linen, that information is to be documented in our logbooks. We're also looking at an internal audit process to ensure that our policies and our procedures are being adhered to.
So if I understand you correctly, you're saying you're looking to develop an internal audit process, or you're working
we
on
are.
an existing
No,
process?
we're looking at right now in terms of auditing our process of how linen exchange and laundry exchange is happening. It is documented in the logbook, and when the clothing box officer goes to the unit with the captain, they are to document on a form that Ms. Sherman received X, Y, and Z, 2 shirts, pants. So there is information, there's a process to log the information.
Okay, I look forward to hearing more about how the complaints that don't rise to the level of grievance are logged, and the audit process as you're developing it. Thank you.
And as we work together, we welcome feedback. We welcome exchange of information as well.
Lipe, and
Thank you, Ms. Page, and thank you for all the hard work you do. Can you explain or describe how is it that people in custody can get access to washing machines and dryers to do their own clothing? I'm asking because there have been multiple circumstances when I talk to particularly young adults or others, people in custody, who talk about that ability being available, but almost like as a privilege, and it is actually very limited. So could you talk to us more about where are the washing machines and the dryers available? How do people get to them? How can it say that they can take on taking care of their clothing?
So each facility has a centralized laundry area that PICs within that facility, laundry is to be done. So again, twice a week, we have uniform exchange. So it's a one-for-one exchange. You give me your soil items, I give you clean items. What we've also seen is that we have, and I can attest to that from touring. I was touring the facility, and I came up with a young person, and I looked, and I'm like, okay, your area, and we talked a little bit, and part of that was hanging on to things. And when I explored a little further, I came to find out that this person had been a victim of homelessness. And so a part of that is not wanting to really give up something. And so those are some of the systemic things that are beyond the Department of Correction that we have to really address and talk about. And but they have the opportunity to launder their personal items two times a week. So each individual is given a wash basin for their own personal items, undergarments. And so with that, they're issued soap, laundry detergent, and twine to ensure that they have the ability to wash their undergarments.
Yeah, I mean, I heard from I think particularly in DC, that there's access to a washer and dryer machine.
Yes, there.
And it seems that it's something that actually a lot of people in custody will look forward to actually use.
Yes.
But it's not clear who gets access to it and how often.
We have workers. We have PICs who are workers, and they are assigned to the officers. And the officers are the ones that work in conjunction with those hired PICs to be able to conduct laundry. And so laundry is a continuous operation. And once it's done, it's folded and it's brought in a bin, in a carrying bin to the units where it is exchanged. Individuals going to court, before they go to court, the direction is to leave your soil material, and upon returning, there will be clean material, there will be clean items for you. So we look for systems, fail-safe systems to ensure that everyone has access to clean linen and clothing.
Thank you again. My sense is that we could work together in
Yes.
actually making sure that those that you serve know this information is not as clear sometimes as it could be, particularly access to doing their own clothing or clothing of others, which seems that actually a lot of them are interested in partaking and helping you out.
Yes.
So let's work together.
Thank you very much. Looking forward to that.
Dr.
Hey,
Cohen,
ma'am, just a-
Dr. Cohen, and then Board Member Pitts.
I appreciate your comments, Commissioner, but you seem to blame the victims on everything here. People are not returning people are holding on to their clothes. People are not exchanging the clothes when they ask. They're not asking when they need it. Our findings are not those. Our findings are that there is serious problems with communication between the staff and the people who are requesting changes of their linen. And if you don't think there's any problem, we should figure out where we're diverging so substantially. Thank you.
So, to answer that, not only am I an associate commissioner, I'm also a retired warden. I'm also a social worker. For me, compassion is absolutely necessary and important. Following the rules are important and necessary. Following our policies are important and necessary. And so I can tell you that it is important to us, it is important to me, it is important to the commissioner who I serve, that people in custody are provided the necessary tools. We understand that there are learned behaviors, and a part of that is to address those things, is to address some of the trauma that folks have faced out in life, and when they come, how we can also help. So blaming the victim is not something that I am saying that I would do. I would say that we'd be looking for opportunities and ways in order to support individuals through a difficult process.
Availability of linens when people want it. There's no availability of people's chance to wash their clothes when they want it.
Dr. Cohen, I certainly am not saying that. I am not saying we come with no issues at all. I am saying that we are in a place and a time where we're looking and we're addressing, we're going to identify an audit process to see how we can better be of service.
Ms. Pitts?
I'm going to date myself. I have a question. Is there a captain in each facility responsible for linen exchange?
Yes, ma'am.
Okay. Now, the facility that in question here was what, West Facility? And that was like a month ago? Okay, and you're telling me that there's a location in the facility where the washers and the dryers are?
Yes, ma'am.
Okay, I find it odd that there would be a whole month without linen exchange. So my question is, was there a supervisor involved with making this happen? And were the machines working? Is it possible that the machines were broken? Do we know why it happened? And has it been resolved?
We will look into that and we'll get back to you on that specific case. There is a captain, and a part of that is ensuring that they're performing the responsibilities of their job functions.
Thank you.
Yes.
Question. Commissioner,
Yes, sir.
Did I hear you correctly that you have some relationship with Correction Industries?
Yes, sir.
And Correction Industries, in Correction Industries, you have a laundry
Yes,
and you have a sewing shop
yes,
for the linen,
yes,
and and your Correction Industries is responsible for delivering these items to the different facilities.
yes, sir.
And in the facilities, you have a captain in charge of dispersing the
And an
items
officer,
to an officer or an officer.
And an officer.
Right,
Yes.
to the inmates.
Yes,
Okay, and you say that you do this frequently.
yes. 2 times a week for clothing and once a week for linens. Going back to Ms. Pitt, if the laundry in a facility, particular facility, if we are having inoperable, if let's say we have an inoperable machine, we do reach out to industries, we do reach out to centralized laundry, and they aid and support us as well.
You notify them, but they don't have a consistent schedule in terms of delivering to the facilities.
There is a schedule, but also, upon needed, we can reach out to them for their support as well. If we do not have an item, a case in point, if someone comes in and their uniforms are soiled and they go through a number of them, if they're coming in ill, then we can reach out if we need additional supplies.
Well,
You're not reaching out to Correction Industries, you're reaching out to the captain in charge
Yes,
of...
the facility has a supply.
Right.
They have a supply of items. If we are moving into a large use of those supply, we can replenish from that source.
Your job is not difficult. I mean, your job is difficult.
Yes.
I'm sorry,
Sorry.
it's I'm reverting back to an old system, and I look forward to visiting your Correction Industries and to be as helpful as we can to help you in achieving some of those goals so that we can continue to replenish the clean items to the inmates that are behind. And you mentioned something to the fact that you're very sensitive to the people that are incarcerated or detained in our system,
yes.
because you were a social worker as
I am
well.
a social worker, sir.
And so it so happens that here on this board, we have several social workers as well. And we understand exactly what you're going through. And if we can be helpful, we would be glad to be as helpful as we can to you.
Thank you. In my position currently, I'm the Associate Commissioner of Operations, but I'm always a social worker by education and by being who I am.
Well, I've been a commissioner 5 different times, and I'm a social worker.
Yes.
But we're here to assist you in any way we can. And we'll make sure that our people in the facilities, they also monitor this situation so that it doesn't happen, and so that people don't have to wait a month in order to be able to get their laundries done at the facilities. So we also have a responsibility to making sure that these people who are less fortunate than some of us,
Yes, sir.
so that they can get their services as well. So if we can work together, we would
Absolutely.
appreciate that.
Absolutely.
Thank you for your support and for what you do.
Thank you. Thank you all.
oh, we're not finished yet,
Oh,
but
well.
thank you. But thank you, though, Associate Commissioner Page. I know you indicated that the incidence, as reported by the Board of Correction, is less than 1%, I think you said?
Yes,
That is reported?
in our December findings, based on what our statistics for December, we found that 27 individuals, we had 27 complaints about laundry or bedding issues and concerns.
Okay, order, please. So my thought is that I have 6 board members.
Yes.
So even though we addressing it as less than 1%, so me as chair hearing 6 board members raise this as an issue, based on their experience and based on their visits and understanding of the system, that there's an issue somewhere.
Yes.
And that being said, I would like to direct our executive director and team to work with you to look at your uniform contracts, your inventory on hand, your forecasts, your exchange one-to-one rates, some of those issues, and I'll let the executive director, Jasmine, perhaps maybe add to what she will work with you on.
Yes, our team has already been planning an assessment into linen exchange, and we look forward to working with you, Associate Commissioner, in partnering with you in your audit, assisting in any way we can. And we're also currently doing an assessment of recreation, and we hope with these assessments to be able to work with you before the board meetings, figure things out, and report back to the board and to the public what we've achieved and been able to fix and move on from there.
That is certainly appreciated and welcomed.
Could I encourage you to include the voices of those in the facility? I mean, it's not unusual for them to talk about their desire to actually clean their clothing and have the place be better. So when we work with you guys, please include their voices.
Okay, the executive director will take that under advisement. Thank you very much, Associate Commissioner Page. I'm just trying to figure out where we're going to go from this point. Okay, thank you.
Thank you all.
Thank you.
All right, have a wonderful afternoon.
We're going to begin CHS updates. We will now turn to DOC and CHS for an update on DOC and CHS's plan for complying with BOC minimum standards 3-02C5, sick call record keeping, and for CHS to update the board on its staffing levels for sick call. Is that a joint presentation, or is that CHS? Or?
Hi, good afternoon. My name is James Saunders, Deputy Commissioner of the Health Affairs Division, Compliance and Quality, joined here by my CHS colleague.
Good afternoon, everyone. My name is Nancy Arias. I am the Chief Nursing Officer for Correctional Health Services.
So I understand that the board had some very specific questions. Do you want to speak to those questions and we'll respond, or do you want us to speak extemporaneously?
1 second. I think we're going to go down the list of the minimum standards and then give you an opportunity to address and then have board members that might have questions.
Excellent. Thank you.
Right, I can just give a background of what the minimum standard says. It's 3-02 subdivision C5, and it requires adequate records shall be maintained daily, which are distinguishable by housing area on a form developed by the Department of Correction. These records shall be maintained for at least 3 years. The form shall include the following: the names and number of inmates requesting sick call, the names and numbers of inmates arriving in the clinic, and the names and number of inmates seen by healthcare personnel. The use of a sick call sign-up sheet shall not preclude the use of sick call by inmates who are not on the list. And we understand from past presentations from CHS and DOC that there is the existence of the CHS health triage line instead of sign-up sheets. So the board just wanted to understand the plan for moving towards compliance with the board's minimum standards in terms of record keeping.
Excellent. So thank you for that question. So I'm not going to bore you with the previous presentations that I think that we gave on 2 separate occasions. But as we indicated earlier, we do rely on our colleagues from CHS to document sick call. There's a health triage line. Every person in custody has a unique personal identifying number that they use. They can either call from their tablet or from the house phone. They input their PIN number, then they call 614#, and they're able to either speak directly with someone on the CHS staff, I believe it's in triage nurse, or they're able to leave a message, and then they will get a call back. And I'm going to let my CHS colleague talk about the triage process. So everyone has access to sick call. That call is documented and recorded. We're able to pull data from our Securus system to measure the volume of calls that are being made and placed by the unique persons in custody. I understand with respect to the Board of Correction minimum standards record-keeping requirement, our colleagues at CHS provide DOC with a monthly list of calls, sick calls. It's a document called Local Law 132, sick call, I think it's sick call form. Not 100% sure, but we do receive that, and we're able to look at the number of calls. We're able to look at the individuals who placed the call and whether or not they were seen and when they were seen. What we, on the DOC side, obviously, to protect the privacy and confidentiality of the purpose of the call, we are not made aware of that individual's reason for calling. We don't, on the DOC side, we don't need to know if they're calling about a medication refill or wound care follow-up. And so that's not data that we're collecting. Our CHS colleagues are protecting that health information and only sharing with us the information that we need in order to monitor access to care. So is there anything else that you want to add? Okay.
Actually, hi, it's Patsy Yang, Senior Vice President for Health and Hospitals, of Health and Hospitals for Correctional Health Services. I just wanted to, thanks, James, clarify that CHS created the health triage line. We started planning this in 2019. I think this was partly in understanding, in conversations with particularly Dr. Cohen about how patients could contact us directly. So we created this line independent of the sick call process so that patients had a way to call us and reach us directly without having to be escorted to clinic. It was not designed and intended to supplant or replace the sick call process. It has probably over time helped in that patients know they can call us and speak to us directly, and that can result in resolution of their concerns or issues either on the phone, administratively afterward, or by an appointment in clinic, which is what DOC escorts people to. The data that we provide to DOC is regarding our process, and that's calls that come to us, and people who, as a result of that conversation on the phone, may need to come to clinic and see us. So what we have is our part of the service. I just wanted to clarify that.
Thank you. So before, I think we had previously shared with the board the directive that was created as part of this process. It's called Daily Sick Call. And so that is our process. People in custody also have access to medical care if they are experiencing extreme or acute symptoms. They're able to go to a correctional officer on the unit and share the fact that they're experiencing acute symptoms, and they will be brought to the clinic forthwith. So, are there any questions?
I have a question.
Ms. Sherman?
Yeah, I have a question. Thank you, both, all three of you. And I have a question following up on Dr. Yang's. It's actually for you. But it's following up on Dr. Yang's comments. I just want to make sure I understand. I think I now understand the documentation that CHS provides to DOC. And I guess I just want to make sure that I also understand what documentation DOC maintains and whether the documents are aligned with the BOC rule requiring the names and number of persons in custody requesting sick call, the names and numbers of persons in custody arriving in the clinic, and the names and number of persons in custody who are seen by healthcare personnel.
So I think that data resides in several places. The names and numbers of people requesting sick call, we can pull from our Securus application because we document the calls that are being made to 614 pound. the people who are the names and numbers of folks arriving to the clinic. We receive on a daily basis a call down list from our colleagues at CHS. It is unknown to DOC why an individual may appear on a call down list, if it's for a sick call, if it's for a wound care follow-up, if it's for methadone maintenance treatment. So we are blind to that. But we do see a daily list, and we're required to produce individuals who are on that list to the clinic. When folks arrive in the clinic, there's a logbook that is kept in each clinic, and it notes the individuals who have been brought down, and that's documented there. So I think all of those 3 points and all those data elements reside somewhere, and we have access to those, and we do keep those records.
Is there someone responsible for tracking them and sort of keeping them all together to at least try and ensure that all those persons who have requested access to sick call arrive in the clinic and are seen by healthcare personnel?
So I think that's a shared responsibility between DOC and CHS. Again, on a monthly basis, we do see who has been produced via the sick call, the health triage line, but there is no reconciliation between the pen and paper and the document that logbook documentation and the Excel spreadsheet that we receive. There's no reconciliation. That's a Herculean task that we will have to try and address in the future when we become more technologically advanced in the agency.
I appreciate your comments, and I appreciate the size of the task. I do think it's really important to have, it's encouraging to hear that all of these data points that are required by the board's rules exist. I think that the board's rules exist and require that information for a reason, and it is to be able to track that folks who require and who believe that they require access to medical care receive that care.
Right.
So I think we need to be able to review all of that data side by side in order to assess whether folks are actually being seen when they need to be seen.
Right. And I agree. I think DOC agrees with that point, and we do rely on the data that's captured in the CHS medical record to advise us who has called and who has been actually seen, and that's the record that we receive. So I think that would address one of the data points then in the BOC standard, right? That you have the name, the booking and case number, and whether or not that person was actually seen. So that data does exist and is shared.
Okay, 1 second, please. I'll have Executive Director Jasmine make some comments. Then we'll go to Dr. Bedard, and then Board Member Felipe and Board Member Cohen.
Thank you, Deputy Commissioner. I was just going to ask, has there ever been a form created to compile all of that data that exists in different places? The board's rule speaks to a form that would have all of this information in one area, and the sign-up sheets as being a part of that record keeping. So is there a plan to go back to the sign-up sheets? Is there a form in development to have all of this information in one place?
So let me answer the first question. So maybe once upon a time there was a form. I haven't been there quite a year yet. I'm almost at that 1 year mark, but I've not seen a form that specifically addresses this issue. That's one. Two, when I've read the minimum standards, I don't see where it says that DOC has to create a sign-up sheet. It appears that is an option. So that's maybe I'm misinterpreting what those rules say, but nowhere in those rules do I see where we are required to have a sign-up sheet.
I mean, I could read 302C5 says that
Okay.
adequate records shall be maintained
Right.
daily on a form developed by the Department of Correction.
Right. So we do have, again, we we have so our sick calls are made through 614-pound. I can pull that data. I can see the individual who made that call, the time that they made that call, where they made the call from. So I have that. What I don't have is a form, right? And again, maybe I'm misinterpreting the rules, but I don't see where it says thou shalt have a sign-up sheet. I think that was an old practice. I think the current practice has changed, and we've moved towards a more advanced practice.
Excuse me, one second.
Let me just try something, and it might be just Jackie. It's picking up, I think, on the same question.
Hold on 1 second. You're going to follow up, and then we're going to move on to other questions. But I do have concern that if there's a new system, if it doesn't comply with the minimum standards of a form, and if you didn't act for a variance of some form, so that we can adhere to monitoring of the minimum standard required. So that we'll revisit back, unless you want to address it right now.
So I would welcome perhaps a separate meeting outside of this forum where we can show you exactly the data points that we keep and how we feel that actually meets the standards that are set forth in the board's rules.
Okay.
Okay?
Thank you. We'll let Dr. Yang follow up, and then Dr. Bedard.
I just wanted, CHS does track and keep records and shares with the department for its collation. Those people who call our health triage line and who, as a result of that phone call, we determine need to be put on a list and called down and escorted to clinic to be seen. We know who those people are. We know whether we've seen them or not. We give that to the department. There are other patients who will be brought unscheduled by officers to us to be seen. That could be through the DOC sick call process, which is a separate process, or for injury or any other reason that a person can express to an officer in their housing area that they wish to be seen without needing to call us. And I think that is a process that still exists, I'm sure, and we're happy to work with the department if they need us, but I think it's a separate, it's the other component of the list that I think you're talking about.
Dr. Bedard?
Thank you all for speaking to this for what feels like the fourth time in as many months. I think the confusion remains around a few different points. There's the conversation about missed sick call appointments and how those missed sick call appointments are tracked, disparity in numbers, how people are seen or not seen again if they aren't seen initially. We're not even talking about that today, right? We're talking today just about how people who want to see a clinician can present themselves to be seen in a timely fashion. And you've only been here for less than a year. Congratulations on your almost 1-year anniversary. I worked at CHS for 6 years through 2022, and so was around for the pre-health triage line period, and then once the health triage line was introduced. In the pre-health triage line period, the way that people would present themselves for sick call was they would go to an officer in the housing area and say, I need to be seen for sick call. The health triage line, I think, was an incredibly important innovation for many reasons. Among them, it was incredibly important during COVID. And I'm incredibly grateful that it still exists. However, for lots of reasons, broken tablets being one of them, people not being able to get to the phone in time, et cetera, there are ways in which the health triage line alone does not feel like a foolproof way for people to get their complaint heard. And whereas the DOC officer who's on the unit is their only real point of contact with the system face to face. And so I think the concern that we keep circling around is the health triage line is one way to make a request for sick call. It does not feel like it is likely capturing the total need for sick call. And we are concerned that it's both not in compliance with the minimum standard and that it's not meeting the need of PIC.
So if a person is experiencing, let's say hypothetically, a fever, they walk over to a correction officer and they express to that correction officer, hey, I'm not feeling well, I've had a cough for 2 days, I'm feeling a bit feverish, I would like to go to the clinic. That officer makes sure that that individual goes to the clinic. It's documented in the A-post logbook when that person leaves for the clinic, and it's documented, the arrival of that individual to the clinic is documented in the clinic logbook. So there is a record kept of individuals leaving a particular unit and arriving in the clinic. Now, what we may not know, obviously, is a diagnosis or anything that's related to health information. But there are records kept, and unfortunately, a lot of the records at DOC are in logbooks, and we're striving to become more technologically
So
advanced.
it's interesting because it sounds like actually there is still an existence of a backup system where people can approach the DOC officer in the unit
Right, that's
to
never-
request being seen. And it really is just that we're all having miscommunication for absence of a form. That sounds like where things are falling apart, which feels like something we could probably fix together, just as you said, offline.
Right. So again, the ability to go to the clinic has never been extinguished. That is a right. That's a minimum standard that we adhere to. The person can always go to a correctional officer and express the need and the desire to go to the clinic. That's never been extinguished by the health triage line. The health triage line has obviously augmented the available pathways to get to the clinic. Okay.
Thank you so much.
Board Member Felipe?
And definitely these are complex matters, but so there's more than one pathway or a way to get to the clinic. And it's hard to keep track of the different 3 ways that you can get to the clinic. From the perspective of someone in custody, I mean, what is it that they should do? Should they try those 3 ways? I mean, should they talk to the officer? Should they make those calls? I mean, I'm concerned about the population that you serve. Historically, is not the most proactively engagers in healthcare. And how is it that we can help them get to the clinic in the least convoluted way?
So the health triage line information appears on the tablet. There's a flyer, and I understand that there is, I believe that there's a poster in the unit. We can verify that, but the information is out there. We get calls, persons in custody make calls to 311. Those calls are routed to us, and we address every single call. Advocates, legal aid, Brooklyn Defenders, Bronx Defenders, attorneys will call, they'll send an email, and they'll say, my client is in desperate need of being seen in the clinic, please make sure that they're seen. We share that information with our colleagues in CHS, and we also inform the facility as well to make sure that that person is seen. Family members, I've personally received phone calls from family members, for example, a mother saying, hey, my son is in dire need of the medication, unfortunately, and then they'll start to share some medical history. I want my son produced to the clinic. We make sure that the facility, the unit, and CHS know that we've got that call and that individual needs to be produced to the clinic immediately. So there are lots of pathways to making sure that folks have access to care, externally and internally.
Are there any other questions from the board?
Thank you.
Thank you.
Elmhurst? Thank you, Patsy. Thank you, Nancy.
I'm sorry.
You added
Yes.
an agenda item, Elmhurst Hospital.
Oh, yes, we did update the agenda
Okay.
to talk about Amherst Hospital. The opening of Elmhurst Psychiatric Clinic, so thank you for bringing that back to us, to the agenda item.
You ready? All right, so just to give a little background, back in, I think, September, October, it was announced that we would be reopening the Elmhurst Hospital prison ward. As you know, it is an inpatient psych unit within Elmhurst Hospital. We provide the security. Elmhurst will provide the clinical care and treatment, right? And it is a hospital-based unit. It is not per se a jail, right? So they'll be able to provide medication in a way that CHS won't be able to provide certain mental health or psychotropic drugs. So just so you know, so we conducted a pre-opening inspection tour back in October of 2023. We identified a number of items that we felt needed to be addressed before we would be able to successfully reopen it. I'm happy to say that our colleagues at Elmhurst, H&H Elmhurst, addressed all of the items that we identified, and we're set to reopen the week of January 22nd. And so we're going to be staffing it with 1 captain and approximately 7 correction officers. And the staff that we've identified have previously worked in Elmhurst Hospital. They're familiar with the institution, they're familiar with the setting. And so we're looking forward to having that reopened and making sure that the female persons in custody have access to quality mental health care.
I'm so thrilled to hear that. I'm very, very grateful to the department for hitting the deadline that we talked about at the last meeting. Thank you very much.
Any other questions?
Yeah, I would just like to say January 27th, 2024 to confirm.
The week of January 22nd, January 22nd, 2024.
Okay, 22nd.
22nd. I think 22nd is a Monday, so that week we intend to reopen.
Sometime the following week, perhaps a number of board members can visit the facility. And
I would just ask that you give us some time to get it opened and running smoothly. And the following week is perfectly fine, but that first week,
the following week. I'm
probably
referring to
have
the following week.
there might be 1 or 2 hiccups, but
That's okay.
it's at your discretion. I would
I'm
just
referring
ask.
to the following week. And,
Okay.
and it's not a visit to sort of catch, say we got you or anything. It's a visit to, sort of celebrate of such a great accomplishment, which is much needed care.
Well,
So,
we would welcome a visit from this board, please. Feel free to come.
Thank you very much.
Okay?
Thank you. And I think now, CHS, do you have updates? Okay, CH, to update the board on its staffing levels for sick call. Did you address that? Sick call.
I think the question is about staff presence in the clinic to accommodate sick call. I think that's Carlos.
Yes, staffing levels for sick calls.
Good afternoon, board members. I'm Carlos Castellanos, Chief Operations Officer for CHS. The staffing levels specifically for health triages, so sick call in this case is integrated with all the medical services. So it varies by facility and by tour, but I could tell you that we have an average of maybe 3 to 7 nurses across all 3 tours, 3 to 6 providers, medical providers, and maybe, I would say maybe 2 to 7 clinicians, mental health staff members across all the services. That's just an average, and we could probably provide more details with the specifics by facility, but that's just an average, so to speak.
Okay, Dr. Bedard.
Carlos, do you have a sense? I think the concern is about whether people are produced for sick call and not seen during that tour. Do you have a sense of whether that happens and how frequently, if it happens, it's related to staffing issues?
I couldn't tell you specifically that it's related to staffing issues. I know that we have a system in place where we readjust staffing levels depending on circumstances in the clinic, but we are open for 2 tours, and we have steady staffing across all the different facilities for that purpose, but wouldn't tell you that it's based on staffing levels on our part.
At the risk of sounding like I'm going in a circle, the staffing that Mr. Castellanos gave is for all of our clinics. Again, this is not about sick call per se. The sick call, what we understand to be sick call, is the DOC process wherein somebody in their housing area speaks to a CO, a correction officer, and asks to come to clinic. We only know those people who are brought to clinic under that circumstance, and when they are brought, we see them as we would any other unscheduled person who presents for care in our clinics. So what Carlos gave was the staffing for all the clinics. It is incorporated. A person presenting unscheduled is seen by the same people who are staffed to see all the scheduled people we have asked to be brought to clinic, generally, however they came in.
Thank you. I think that's been very helpful. Are there any other questions from board members? Okay, thank you, CHS. COBA updates. We will now turn to COBA for updates regarding staff concerns. Good afternoon.
Good afternoon and Happy New Year to all of you. Welcome. I'm sorry I missed the first 10 minutes, but welcome. Good afternoon. My name is Asaki Antoine. I am the 3rd Vice President of the Correction Officers Benevolent Association. For the past 3 years, I have dedicated myself to speaking about the harsh realities faced by correctional officers while working on Rikers Island. Through countless testimonies, I have shared the disturbing truth about the rampant assaults on correctional officers by violent detainees. I have also shed light on the physical, mental, emotional, and psychological traumas that correctional officers face on a daily basis. As a female COBA representative, speaking on behalf of all female sexual assault victims who bravely continue to patrol the toughest precincts in New York City, which are the jails, on Rikers Island and off. I have shared intense testimonies. I have shared personal traumas filled with emotions, mixed with the ultimate violation of being touched in the most sacred place on your body while at work and without consent. 2 weeks ago, one of our female officers was pulled in a cell by one of the detainees. She fought that detainee off. If she did not, we would be here speaking about an intense sexual assault. It is alarming to see that these detainees are able to commit life-altering crimes against not just correctional officers, but also civilians, medical staff, and nonviolent inmates without being held accountable. What is more concerning is that thanks to the selective activism by the public advocate and the city council members, these detainees now have a green light to commit serious acts of violence and will only be given a 4-hour timeout session. So, for example, the detainee touches my breast, touches my vagina, the detainee breaks my eye socket, the detainee slashes another detainee. The only way to hold this detainee accountable is to remove the detainee out the housing area for a 4-hour timeout and return the detainee back to the scene of the crime at the 5th hour. Is that real accountability? Is it? It's unacceptable. Please pay attention to the following COBA stats of 2023. Over 730 assaults on staff. Over 200 correction officers were spat on. Over 650 officers were splashed with feces, urine, and other unknown substances.
Excuse me, I hate to interrupt, but I missed the part that I feel is important. You said 200?
Over 200 correction officers were spat on. Over 650 officers were splashed with feces, urine, and unknown substances. Over 500 fires were set by detainees. Over 600 inmate serious injuries. These significant assaults raise questions about the safety for correction officers, civilians, medical staff, and again, non-violent inmates. In 2023, the BOC published 3 special investigation reports that shed light on critical events, policy adherence concerns, and recommendations. Based on COBA statistics, in which I provided in my previous testimonies, moving forward, I'm requesting a special investigation report published by you, the BOC, into every assault on a correction officer, every sexual assault on a female correction officer, every fire set by the detainees, and every inmate on inmate serious injury. Let's discontinue this one-sided agenda. On November 29, 2023, I sent an email to you all outlining several issues that needed to be addressed concerning the West facility. I received acknowledgement from the BOC, but unfortunately, it seems that these concerns have fallen on deaf ears once again. I'm still waiting for an update regarding the renovation of the officer's restroom in the general office. I'm still waiting for a resolution regarding the intake area. I'm still waiting for an update regarding the operations order of 19 of 17, which speaks of splashings. It's disheartening to hear that these issues have not been resolved. I urge the BOC to take action and prioritize these matters for the safety and well-being of both correction officers and detainees. In closing, this is the first BOC meeting for the new year, and it is important to address all issues, whether in a public forum or via email, with the same urgency as the detainees' issues brought before you. I want to remind you that as the oversight entity for everyone working on Rikers Island, it is your responsibility to ensure the well-being of those housed there temporarily, and also to address any and all adverse effects that correction officers endure. We must work together to get things done and improve jail's conditions for both correction officers and everyone there on Rikers Island. This is a new year and a fresh start. Let's make it a priority to tackle these issues and create a safer and more efficient environment for all involved. Thank you. But I want to add these 2 things because I listen here today, testimonies, questions asked, and I have to bring this to the forefront. There are 2 things that needs to be addressed by COBA. The question posed was that to have the detainees attend in-person BOC meetings, correct? Yes? There are major security issues concerning that. And I will be forwarding those issues formally to you all. It is a safety issue and a security issue for everyone in here and outside of this venue. That's one. Two, linen. You all tour, I tour. Mr. Cohen, you basically stated that the detainees who don't receive linen, you basically said they were victims of not getting linen. Yes?
No, I said that the commissioner said that they were not asking, or they were injured by their prior upbringing, and therefore that's why the linen
Yeah,
wasn't. I said it was victim blaming.
Okay. So I just want you to know this. I tour, my partners tour, you all tour. I'm not sold on the fact that the detainees are not getting linen. When I tour, I see linen on the floor, not on their bed. I see blankets on the floor, not on their bed. I see sheets blocking the obstructions of view, not on their bed. So if we're going to follow the rules, right, and if linen is to be soiled linen is to be returned so that the detainees get a new one, the linen should not be on the floor. The blankets should not be on the floor. The blankets, the linen, the pillowcase, the mattress should be on the bed for its purpose and its purpose only. That's it.
Well, thank you. Board members, will you accept questions from the board at this time?
Oh, sure.
Yes, go ahead.
Thank you,
Alderman Duke.
and thank you for the welcome. Just for my own edification, you had referenced a 4-hour timeout. Are there any prescribed forms of discipline aside from the 4-hour timeout?
No. No. Officers are writing infractions, and the detainees are not held accountable. Period. That's it. Outside of ESH or RESH, where they are there for a limited amount of time, there's no accountability.
Could you just explain?
Hence why, and I'll go back to my stats, COVID stats. Hence why 200 officers were spat on. Hence why you have 730 officers assaulted. Hence why you have over 650 officers splashed with feces and urine and other unknown liquids. Hence why you have 500 fires set. There is no immediate accountability for these crimes committed while they are detained.
Are there any other questions from board members?
Maybe, sorry for my ignorance, but isn't this information made available to the court when an inmate injures or attacks someone?
Of course, you
Okay.
guys.
I mean, I think the court it has the role to set up consequences.
And so do you. And so do you.
Yeah.
And so do you. So we're not gonna, we are not gonna push this over to the courts. So do you. You see it. You're touring. You see the same thing I see. You watch the Gentech. So do you. So we're not gonna pass the buck. Not in 2024. We're not gonna do that.
Yes, thank you. I'd just like to say that I did acknowledge that your concern about detainees attending in person, and certainly any security issues are a priority for me as the chair, And so certainly that will be under considerable review before, or as we, the discussions between the department and the board commence. Okay? Certainly appreciate your statistics. I am concerned that you feel that an email was sent to the board that did not meet some of your, we didn't address some of them.
Any of them?
We acknowledged it, receipt, but we didn't address any of them. I'd ask that the chair receives a copy of your email, because, all concerns, for officers, civilian staff, persons in custodies, for this board is of concern. And this is an independent oversight board, and that is a charter mandate. And so we're not looking at politics on how we address this. So I'd like to see that, the email that was sent and how we respond.
You'll receive it. And one more thing, Ms. Pitts, regarding the Women in the Jails initiative. Is there an update concerning that?
Not at this time. I'm sorry to say. We've had some staffing issues and other events that have delayed the progress. I can give you more specifics at another time.
Okay.
But please note that the Women in the Jail Committee and the activity remains a high priority for this board. And I feel that the department has a big concern to move the committee's concerns and projects forward. So stay tuned. It's just some delay, but we will be moving forward.
Thank you, Chair. Before I depart, I just want to say this. I want correctional officers' issues and concerns to weigh as much as the detainees. And it appears at times that it's a one-sided thing. And although you all say you're committed, and I sincerely think, well, I would like to think that you all are, it's one-sided every month. I forwarded issues that concerned correctional officers 2 months ago. 2 months ago. And nothing. But when the detainees forward something via 311, via grievance, via telephone, everyone is jumping to attention. It's not right. It's not right.
Yeah. Your response is noted by this board. Again, I'd like to see your email and the response to it, because corrections officers, civilian staff, persons in custodies is an equal concern for this board. And the response and the responsiveness that must be provided for all concerns. And I'll say that some might say that uniform staff has a union. We don't want to get involved with union concerns. But that's not our charter as a board. And so we have to follow our charter, and that's my goal and objective as chair of this board.
All right, thank you.
Thank you.
All right.
But I did get the original reports. I just want to apologize to COBA. I was advised that was sent your email when it originally went out. I was out of the country for almost a month, so I did not see it, but I will pay attention to it. For the month of December, if you sent it, I probably didn't see it, okay? So right now, we will move to public comment. We will now hear comments from the general public.
The first person is Mary Merkel.
Good afternoon. My name is Mary Merkel, and I am an Equal Justice Works Fellow sponsored by Greenberg-Traurig, and through my fellowship, I am working in the education project at the Bronx Defenders. As part of my fellowship project, I have been interviewing Bronx Defenders clients who are between the ages of 18 to 21 and currently incarcerated. The interviews focus on asking our clients about their education goals and needs, and we then advocate for our clients differently depending on those goals and needs. I began these interviews in mid-October, and so far I have interviewed 6 clients who are currently incarcerated at Rikers. Of these 6 clients, 5 requested educational advocacy. 4 wanted to be enrolled in the GED program. To date, only 1 of these clients has actually been enrolled in the program. The first request we made for his enrollment was on October 26, 2023, but the client had additionally made earlier requests on his own. He began attending the program on December 5th, 2023. In order to attend classes, he had to be transferred to a new housing unit. This client waited for over a month to be enrolled in a program that will have significant positive impacts on his life. Needing to be transferred to a new housing unit is a common thread in my experience advocating for our clients. For example, another client who wanted to be enrolled in the GED program cannot attend school because his current housing unit is not brought to school. He is unwilling to move housing units because of safety concerns. He was forced to choose between attending school and maintaining his personal safety. Additionally, our clients who are housed in enhanced supervision housing are summarily denied any access to school. We ask that all eligible young people be given access to education services no matter what housing unit they are in. Young people should not have to choose between their safety and their future, and they should not have to make multiple requests and wait months to receive services that they are legally entitled to. Thank you for your time.
Thank you.
Thank you. The next person is Michael Klinger.
Yeah, and please note during the public comment section, a board member may have a question. So if a question is asked, I'll ask that you remain after your statement.
Good afternoon. My name is Michael Klinger. I am a jail services attorney with Brooklyn Defender Services. Thank you for the opportunity to speak today. To begin, we want to take a moment to express our condolences to the family and loved ones of Mr. Williams, who died last week at EMTC on Rikers Island. And to the department and the board, our anger and frustration that people continue to die while they are held in department custody. Today's agenda included an opportunity for the department to explain how it plans to address complaints involving a lack of bedding, of linen exchange, and of laundry services, all of which are required under the minimum standards. These exact concerns have been the subject of frequent communications from our office to both the department and the board for a period of years. These deprivations are not experienced in a vacuum, but instead as part of a whole set of deprivations: a lack of access to general hygiene, to recreation, religious services, to contact visits, to healthy and satisfying meals, to safety, to uninterrupted sleep, to phone calls, to tablets, to education, to programming, and to medical services. For example, one person who had laundry service only once in the course of a month also reported that the food in his unit was served by pantry workers who had no utensils. So they were forced to serve meals using only their plastic gloved hands. In our client's experience, the department rarely carries out laundry services that provide people with a clean change of clothing at least twice per week at the department's expense as required by the minimum standards. When laundry services for clothing are not provided, our clients report that they are told by CEOs to wash their own clothes, and many times they are left with no other choice but to do so. However, people do not have access to proper laundry facilities. Rather, they must purchase detergent with their own funds through commissary or use the shower soap that they are sometimes issued. While some people have plastic bins that they can use to do their washing, many people report that they wear their clothes into the showers and wash the clothes well on their bodies. Whether they wash in a basin or in the shower, it is both difficult and time-consuming to dry their clothes. Some people report laying wet clothing on their bed to dry, but this makes the bed damp. Because it takes time to air dry clothes, people who try often don't have clothing to wear while they wait, and thus won't be permitted to leave the housing unit. That in turn means possibly missing recreation, sometimes missing meals, or anything else that would require them to be properly dressed to leave the unit. Sometimes in order to have access to recreation or a meal, people choose to wear their soaking wet clothes. We looked back just over the past 8 weeks to provide you with a sense of the housing units where we know laundry services are not consistently being offered. We found complaints from OBCC, GRVC, EMTC, and RNDC, with the most recent complaints coming just 1 week ago. This is a pervasive problem in nearly every facility, and we have yet to see sustained improvement despite voicing our concerns for years. Because the conditions experienced by our clients are so wildly different from those guaranteed by the minimum standards, we urge the board to monitor and provide the public information on the department's compliance with every requirement in Section 103, and to revisit this topic as an agenda item at these meetings at least twice each year, and to require updates from the commissioner. Thank you.
Thank you. If you have a summary of your complaints, a log, if you can provide that to the board, that would help us in maybe internally ordering our responses to complaints and grievances.
I'm sure we can provide some tracking record of the complaints that we've sent.
Okay, thank you.
Sure.
Thank you. The next person is Chaplain Dr. Victoria A. Phillips. Dr. V.
Welcome. Peace and blessings, everyone. I'm Chaplain. Oh, why are we so close? Okay. Peace and blessings, everyone. I'm Chaplain Dr. Victoria A. Phillips. Happy and healthy 2024. I'm also the CEO and founder of Visionary Ministries, and I'm part of the Jails Action Coalition. Open thy mouth, judge righteously, and plead the cause of the poor and needy. Proverbs 31:9. So I just want to touch on a few things in no particular order. If DOC waits for CHS and CHS is waiting for DOC to say who needs to be produced, how does BOC hold them accountable when they fall short? You know, this is a conversation that we've had many, many times in this room. I even have stood before you all years ago when Commissioner Brand was trying to remove clergy out, and one of the reasons I said clergy needs to stay in the facilities, and I actually produced signatures even from officers, uniform officers, saying clergy should stay in the building because clergy is a lifeline for many times with people who need access to sick call. And they wanted to put them in DOC. And also, if you need further reference to what I'm saying, you know, your ex-co-chair, Stanley Richards, had actually talked to a DOC doctor who was let go after talking to y'all about this on the record, Dr. Adams, in 2019, about how DOC falls short in producing people for sick call. And many of the questions you asked today, DOC couldn't answer in 2019, and in 2024, they still fall short. Today, a caller gave grave information regarding his grievance and actual officer names on the record. And so I just want to put on the record that I hope BOC has already assured and secured his safety with all the details that he gave you. Lynning is also another conversation we have had in this room many times on the record. And I've actually played direct calls from people suffering behind the walls to this board. And you know, it's just crazy to me. You know, DOC has many facilities on Rikers, buses, guns, boats. They have access to many things, and yet one of our board members today was looking for a reason on why linen possibly could not be provided within 30 days. There's absolutely no reason that DOC cannot provide clean linen, whether a machine broke down or not, to anyone in their care, custody, and control. They have to follow minimum standards. I also want to address that America has always been forced to give BIPOC, the black community, you know, the bare minimum. And so I was enlightened today. I was so happy to hear the new commissioners when she spoke of integrity, when she spoke of her commitment to DOC and the people we serve. Her words, right? And so, and she also said she remains committed to providing minimum standards. And I appreciate that. I can't tell you how much, because I would rather work with you than organize against you. And so I'm saying that because this is the time that we cannot have excuses. This is the time that we should acknowledge that on both sides of the conversation are heartbeats and real lives and people that require immediate responses. And so I'll wrap up by saying, you know, DOC stood up and responded to sick call, which is also a conversation we have said for so many times up here. And immediately, the response from DOC was about excuses or reasons why or what they might have misread, you know, in the minimum standards. And I just want to say, even with less than a year on the job, can we in 2022, because this is the year of the 8, 8 is the year of results. 8 is the year of reaping what you sow. 8 is the year of producing and getting stuff done. So in the year of the 8, can we acknowledge that there is no room for excuses, that real lives are on the line? We lost one last week, and even though you might believe that he died while playing basketball, and so there's a relief in the sense that it might not be DOC's fault, you still have a job to do. And I just want to lastly say that I'm a mother, and I birthed an entire human being in less than 10 months. So I am not interested in any excuses anyone has on how long they've been on the job and why they have fallen short on producing a farm. Peace and blessings, everyone.
You have a question?
No, it's just a, Dr. V, hi, Happy New Year.
I never had a question. I'm so shocked. Go ahead.
No.
Hit me with it.
It's not a question, it's just to say that we heard you about the caller who revealed sensitive information, and we will make sure that staff see that person and that we follow up on it, because I also was worried about that. So thank you for bringing it to our attention.
That's it? Well, can I just say, can I get 20 more seconds?
That's it.
I just want to say, you know, in 2022, I stood before you and I actually showed an officer who was disrespectful on the steps when I stood outside, and we talked about solitary bail. That's what was brought up. And I'm saying that for only one reason, so we can move forward together, right? And I pointed that officer out in 2023, and I had video and everything of him actually saying vulgar things to us on the steps, and a council member who also testified about that. I'm saying that because you have a video on your website of a hearing last year when I pointed that officer out, when the third vice president, and I don't know the lady sitting with her title, but they stood up here today together, were actually on the video sandmanning me as if they didn't want to hear it. And the former executive director had to tell the room that I was allowed to speak. In 2024, when we say that we respect women, when we say that because I've stood outside at press conferences and spoke up for officers being assaulted, even when advocates got mad at me. I'm not about picking sides. I'm about humanity and what's right for all of my community members. So with that being said, if we're going to truly stand as leaders and show officers how the job is supposed to be done, can we do that in this room together respectfully? And everybody that's in a position of power, stand up on your business and be respectful and get the job done, because halving it ain't getting it. Lives is on the line. Peace and blessings.
Thank you very much.
Thank you, Dr. V. The next speaker is Natalie Fiorenzo.
Good afternoon, everybody. First things first, DOC is still here. This is huge. I've literally never seen this. So, sincere thank yous to the new commissioner, and I really hope this is symbolic of a partnership to move forward and listen to advocates. Anyway, my name is Natalie Fiorenzo. I am a corrections specialist at New York County Defenders. I work regularly with our incarcerated clients to advocate for their rights while they're detained in DOC custody. This is our first meeting of the year, and I'd like to begin by saying a couple of thank yous. First, thank you for choosing to put specific minimum standards issues on today's agenda. A few months ago, the emergency executive orders were on the agenda, and as advocates, we urge you to keep a closer eye on the minimum standards violations that are happening at Rikers. We continue to notice that under the protection of the emergency executive orders, DOC chooses to disregard minimum standards in a lot of ways. By asking about minimum standards adherence at the hearings, you're making it clear to the department that the EEOs should not be used as an excuse to give up on providing minimum standards to people in custody. That instead, there needs to be a thoughtful action plan and accountability to that plan that strives to give people minimum standards to the best of their ability. And we urge you to keep pushing until you get straight answers at these hearings as well. Secondly, thank you for investigating the fire at NYC and releasing the report on your findings. That was something that we pushed for the majority of last year, and it was truly illuminating to see what you as a board had the power to uncover and share with the public. Now, looking forward to the 2024 that lies ahead of us, what are some goals we can set for the new year? So here are a few that came to mind for me. The special investigation report showed that the department did not complete a single fire safety check in 13 months leading up to that fire. Had the catastrophic events of April 6th not occurred, that would probably still be happening today. Without enforcement and diligent attention to righting these wrongs, something like that will happen again. We would like to suggest to the board that you ask DOC at the start of each meeting to report on their compliance to the mandatory weekly and monthly fire checks. The special investigation report also stated that pursuant to the board's minimum standards on restrictive housing, DOC operates the structurally restrictive units at NIC as a form of restrictive housing. The NIC cages have been illegal solitary confinement cells for far too long. We've reached the point where New York City is in the process of paying out $53 million of taxpayer dollars to people who have been held in those cages due to their illegal nature. How long are we going to pay for DOC's mistakes? It should be at the forefront of the board's objectives for 2024 to have these cages shut once and for all. Finally, the dangers of drug use continue to be a huge issue on the island. Our ask here is for the board to maybe form a research committee to look into the benefits of potentially providing detainees with naloxone. I was working with a client who was sent to Bellevue for a medical emergency, and he was discharged from Bellevue with a prescription for Narcan. Now, CHS can't provide that because it's considered contraband. Some corrections officers carry Narcan, but as we've seen time and time again, it's often detainees who are actually the first responders when something goes wrong. As noted in the board's most recent death report, no B-post officer and inadequate touring were identified as factors that contributed to deaths. Providing detainees with Narcan is certainly a suggestion worth the research, considering how many lives it may save. Thank you very much.
Thank you. The next speaker is Rachel Schneiderman.
Good afternoon. My name is Rachel Schneiderman, and I'm a corrections specialist at New York County Defender Services. I want to reiterate my colleague Natalie's sentiments and express my gratitude to the board for listening to us and completing this crucial investigation and report on the April 6th fire. This brought light to the agency failures and negligence that allowed this fire to occur in the first place, and we hope that the report will lead to lasting change that will prevent the harm of incarcerated people and DOC staff alike. Today I want to talk about two issues regarding tablet access. I think it can be easy to push issues with tablets to the side, thinking that they're trivial or low priority, but I hope that my testimony today will clarify the importance of tablet access and how the ways in which it's taken away from incarcerated people is symptomatic of larger cultural and systemic issues. The first issue is that, as we heard from an incarcerated person who testified earlier today, it's almost impossible to get a tablet replaced. This is the case for clients whose tablets have been stolen. This is the case for clients whose tablets have been lost when moved from one housing unit to another. As this board is likely aware, those incarcerated on Rikers have little to no autonomy when moved from one housing unit to the next and are often moved without warning. This means that a housing transfer almost always coincides with the loss of any and all property, including tablets. Some of our clients in this exact situation have no way of obtaining a new tablet once moved because they are then listed in DOC's system as having destroyed their tablet and then stripped of their right to have access to one. This is incredibly concerning given the many minimum standards that tablets have de facto come to replace. For example, I have many clients who rely on their tablets to have access to the law library, to make phone calls to their defense team or their loved ones, and tablets provide meaningful programming that is currently inaccessible to clients. If tablets are the substitute for our clients' constitutionally guaranteed rights, such as access to counsel, it is unacceptable to systematically fail to provide individuals with replacement tablets. The other major issue regarding tablets is the removal of phone, commissary, and radio apps during housing unit lock-ins. Our office has heard numerous reports from clients across multiple facilities that during lock-ins, these essential functions of their tablets are suddenly shut off. There's absolutely no reason for this to happen. To cut off communication with the outside world during a lock-in, which is already extremely isolating, is a dangerous and fear-mongering tactic intended to create a hostile environment for incarcerated people and prevent them from being able to file grievances or call 311 about the violation of their rights. It is completely unacceptable. Our office has already foiled the tablet policy from DOC, but we're asking the board to advocate to make this policy publicly available and clarify the policy on tablet access during lock-in specifically so that we can advocate for them accordingly. Thank you for the opportunity to testify, and feel free to reach out with any questions.
Thank you. I think that, I guess the chair's discretion, I'd like to, at any point, because the department is here during public comments, COBRA's here during public comments, CHS is here during public comments. In light of time and time considerations, if allowable, if any of you determine that you would like to rebut or respond to a public comment, you can request that, maybe a 30-second rebuttal or discussion. Because why is that important, I think? I think it's important because I don't think that many of us have been hearing each other or really working together or really acknowledging. Maybe we'll try it, and if there's any takers of it, so be it. If not, there's no prejudice held, but it's an opportunity.
Thank you. The next speaker is Veronica Vela.
Hi, good afternoon. I want to thank the board for continuing to ask questions about access to medical care in the jails. First, I want to say that in my many conversations with people in custody, I have never heard there to be a separate sick call process to sign up other than the triage line. There simply do not appear to be two separate processes. And when people do get an appointment, the non-production to those appointments is staggeringly high and growing. In December 2021, in a legal aid case entitled Agnew, the New York court issued an order reinforcing DOC's legal obligation to provide access to care. So when the department interferes and delays these medical appointments, it violates both the minimum standards and a court order. DOC maintains that they have fixed the problems getting people to care, but the only numbers we have to challenge these are non-production data that is produced by the department and published online. Advocates do not have the means to check their accuracy, and I'm hoping that you, the board, will provide that check. The department is chronically several months behind in publishing their data, and it is often incomplete, recently lacking numbers from RESH and the new rest facility dorm. In October, DOC nonetheless reported over 14,000 missed appointments. So what is the real number? We urge that you demand current underlying documentation of the type discussed today so that you can evaluate the department's compliance in close to real time. I also urge the board to look into the documentation of appointment refusals. DOC's own procedures require videotape of those refusals, but this doesn't happen, perhaps because the refusals are not happening. October stats reflect that 80% of scheduled appointments at RMSC were refused. Same for GRVC. In OBCC, well over half. And the overall numbers of refusals keeps increasing, over 7,000 in October, which is more than what the total number of non-productions was when we filed AGNU. So why would people go through all the significant effort to request their medical appointment only to refuse them? Review of our clients' medical records show multiple persons in custody reported by DOC as refusing over a dozen appointments in 1 month, but who had no idea that they ever had those appointments because they were never called out. They continually request access to care without success. One individual was denied access to a wheelchair to get to his appointment, and then that was logged as a refusal. DOC also attributes missed appointments to limited waiting space in the clinics. With the number of facilities that have been renovated and reopened, how can DOC justify insufficient waiting space to accommodate the people who have clinic appointments? I urge the board to investigate the waiting capacity in each facility and whether the department can show that the non-productions are truly attributable to these constraints. Finally, I want to again encourage the board to use any tools it has to resist the ongoing use of emergency executive orders to sidestep the minimum standards. There's no doubt that the situation on Rikers is dire, but renewing an emergency order every 5 days for literally years to be free from the restraints of the minimum standards without any showing of the effectiveness of this approach reveals a complete lack of good faith efforts by Rikers management to come up with true solutions to the entrenched problems on Rikers. Thank you.
Thank you.
Thank you. The next speaker is Eileen Mayer.
Good afternoon. My name is Eileen Marr. I am a civil rights union leader from Vocal, New York, a social worker, and a survivor of the abject terror that defines Rikers Island, where I spent over 427 days. Let me begin with my condolences to the family and friends of Mr. Williams, a New York City detainee who was murdered by DOC, as per their usual. Our new commissioner claims that COs quickly performed all life-saving techniques and methods to try and save his life. However, it has since been intimated to me by more than one current detainee and another officer that this is false. COs delayed any life-saving matters, and that there was not even a basketball game going on or even rec going on. I was praying that with a new year, and dare I say, a new commissioner, things may improve. Then, lo and behold, a couple days into the new year, another detainee murdered, another human being who was murdered. The sheer isolation and distance of Rikers continues to breed an environment of corruption, abuse, sexual abuse, and every form of neglect humanly possible. But that's the thing. DOC and our mayor's office don't see the detainees as human beings. They continue to see them as not real people, garbage, whores, dumb broads, and other derogatory insults. I know, because they called me the same names. Methadone and medication for other chronic illnesses and conditions continues to be withheld or delayed for sport. 99% of the narcotics and weapons that are making their way into facilities do so by trafficking networks run solely by correction officers, supervisory officers, and DOC staff. Rec, law library, and announcement of sick call rarely occur, and this goes for all of the facilities. Mammograms are not current, and when asked for by a detainee, especially those who are over 40 or with a family history of breast cancer, even cancer, are told whenever we get to it. As for how sick call is called, somewhere between 5 and 6 in the morning, maybe 7, someone comes to the head of the unit, whispers, sick call. Well, everyone's asleep, and then walks away. So that's how sick call is called. And if a detainee has to have an on-site x-ray, trust and believe that the individual being x-rayed are not getting the use of the anti-radiation apron. As for solitary confinement, if anyone believes that it is being suspended and has not been used in any of the facilities, I have a bridge to sell you. And then there are those medieval shackle chairs that have been continued to be used as recent as this morning. Solitary confinement has been illegal in New York State for now over 4 years. And New York City recently passed a law barring it within the 5 boroughs. And they only did that because of the flagrant disobedience of the state law. So as New York City has done when local union officials violate the no strike clauses in the Taylor laws, the DOC commissioner and her staff must be arrested upon every single violation of the solitary confinement laws. And as an abolitionist, it pains me to say that, but notice, I never said detained. Every month, my fellow organizers and the detainees have, and their parents and individual attorneys have testified about the inhumane conditions within DOC. And we give you a step-by-step blueprint as to how to achieve this. Close the island and the boat. Retraining does not work. So an entirely new staff may be needed, and properly educate any and everyone who programs or works in any of the facilities. A major windfall of programming and services must occur. All detainees must be brought to each and every court appointment. Fentanyl and xylazine tests must be made available to the detainees without punishment, since no one can get a handle on the epic level of narcotics and weapon trafficking. And in conclusion, let me share with you what would happen when a detainee would make a complaint. Even if the incident occurred in front of said officers and even on camera, they would respond, "No, it didn't. Now shut the fuck up and sit the fuck down." Their words, not mine. But I heard it with my own ears and saw it with my own eyes. Oh, and 1 pair of uniform pants? Seriously, even upstate we got 4 pairs. It's ridiculous. Thank you.
Okay, thank you.
Thank you. We don't have anybody who signed up to speak online, but if you are online and want to make a comment, please use the portion of the app that allows you to raise your hand, and we'll review that, and the chair will.
Yeah, but also at this time, as I indicated earlier, any of the parties that would like to possibly respond to any of the public comments, it's an opportunity to do so. You don't have to, but it is an opportunity. If there's none, I'll move, I'd like to thank you to everyone, say thank you to everyone for attending and participating in today's meeting. Our next meeting is scheduled to take place on Tuesday, February 13th, 2024 at 1 p.m. So at this time, I will entertain a motion to adjourn. Is there a second? Second. Okay. All in favor for adjournment? No objections. This meeting is now adjourned.